First of all, welcome everyone for joining us today for this really very amazing alternative healing modality. That is really when you will the Gaynor will be telling about this all training and what is RMT basically. So you will be really um, appreciate that it is really a good opportunity to learn from that. Okay, so first of all, I will be telling about this opportunity about what is integrated holistic wellness and a little introduction about me as well. At integrated holistic wellness, we believe that true healing goes beyond treating symptoms. It involves identification, understanding, and addressing the root cause of health challenge on every level. And our mission is basically to empower individuals by creating awareness about how deeply physical, emotional, mental, and spiritual trauma impact health and well being. And by combining the best of Eastern wisdom and the Western sciences, at ISW, we offer a unique integrative approach of treatment that uncovers and heals these hidden layers of health traumas. We bring cutting edge therapies from around the world to provide access to holistic modalities that transform the lives. What are the core therapies that is included in our approach? First of all, is the functional neurology, that is basically improving brain function and nervous system balance for overall health. Then we use the functional medicine, a personalized approach to root cause to the long term wellness. Quantum energy healing, harmonizing the body's energy field to support the deep healing. Craniosacral therapy, it is a gentle releasing tensions from craniosacral system. Fascia unwinding, relieving the restrictions in the connective tissues to promote natural alignment. Then some osteopathic manual therapies are there, restoring the body's structure balance for optimal health. And then for the emotions, there is an emotion code therapy that release the trapped emotions that may be affecting physical and mental health. Our vision is basically to transform healthcare approach by making advanced holistic treatment accessible and empowering people to achieve vibrant health naturally and holistically. Okay, so my name is Rabia Jamal, and here are some specialized my trainings that I am using for this integrative approach. Firstly, I'm certified in Melillo method for neurodevelopmental and neurobehavioral disorders. Then I'm certified in functional neurology, dynamic movement intervention therapy that is used for promoting the gross motor skills for children with the neurodevelopmental delays. Then from the Chikli Health Institute, I'm specialized in lymphatic drainage therapy, brain therapy, and the heart-centered therapy that basically works with the heart, with the emotions. Then the functional medicine, fascia unwinding, spinal energetics. It is an amazing the modality that works basically the different layers of the trauma, the physical layer, the emotional layer, mental layer, energetic layer, spiritual layer, and then the higher soul layer. And after that, I'm also specialized in movement lesson. It's a very gentle technique to improve the movement patterns for special kids, neurodevelopmental delays, and all that. And osteodos, it's a quite unique osteopathic technique for structural alignment. And next, you will be seeing that how this combination is working so well for different conditions. So basically, we are working for neurodevelopmental disorders, autism, cerebral palsy, learning difficulties, ADHD. Then there are neurodegenerative conditions, Parkinson's disease, Alzheimer, dementia. And also, we give some supportive care for chronic conditions like cancer treatment, fertility and infertility challenges, birth trauma, especially with the plagiocefali torticollis and the vagus nerve dysfunctioning with the infants. Then also we work for the autoimmunity, gastrointestinal conditions, and okay, so here are a few pre and post session of our body release that mostly in our regular system, the with therapies are giving the results after so many months or sometime years also, but we are giving these results in just one session. So as in this oral motor release, you can see that what was the condition of the tongue, the what was the condition of the air passage, and nasal passages. So this is the just one session result of pre and post release of the body. Here, this is a change in the bite. Again, it's a 2-session result that you can see how the lower jaw was underdeveloped. So after second session, how it started becoming aligned. So this is basically is the power of this integrative approach of holistic wellness. Here is a testimonial for our kids who have the neurodevelopmental conditions. So here is some pre and post treatment results.
Inna ma'al usri yusra. Guarantee with difficulty there is ease. One of our predecessors, Muhammad ibn Shubruma, whenever he would be affected by a challenge in his life, his motto statement was what? Sahaba. It's a cloud. It's going to pass. It's a cloud. It's going to pass. That's the mentality of a believer. How many people do you know who are in the clutches of severe grief, loss of money, loss of friends, loss of family, loss of health, whatever it may be? And during that time, they believe that this will be the misery that will cripple them. This will be the one that will bring them to their knees. This will be the one that will see me never recovering. This will be the one that will drive me to my grave. Guess what happened? Weeks, days, months elapsed. They recovered. They got over it. They moved on. They grew. And now, what was once a heart-wrenching tragedy in the past has now become distant memory and chit-chat. Do you recall?
Okay, so now there is another testimonial with a pre and post release of a session of a Parkinson's patient, and how did with different modalities I worked. And this is the pre-session, and then there will be the post-session results. We can see how much restricted his body was, what was the range of motion now. And after 45-minute session, you can see now his posture, his range of motion, his mobility, even though you can see the freshness on his face as well. Okay, so how the RMTI is a natural fit for IHW's approach. When I started this holistic wellness journey, so this was, I guess, the third certification that I did. And with my body release sessions, wherever I feel that there is a very stubborn layer of trauma, so in my toolbox, this is the first therapy that I used for this body release. So it is really a very powerful tool for those like who are practitioners and who wanted to work for any neurodevelopmental conditions. So RMTI basically supports brain development through natural movements, enhance focus, emotional balance, and coordination, used worldwide for neurological learning and sensory challenges. Okay, so now I will be inviting Gaynor, and then I will be sharing her presentation. Yes, everyone can see. Gaynor, can you see, please?
Yeah. Yes, I can see. Hi, good morning, everybody. I'm so sorry for the technical problems. Can you believe what we would call Murphy's Law to have technical problems on a day like this? So thank you very much for joining. Rabia has very kindly invited me to speak to you about rhythmic movement training. So first of all, just to let you know a little bit about me, I have a teaching background. I did a bachelor in primary education in South Africa. I grew up in Zimbabwe, and I started my career as a primary school teacher. I taught for 20 years. But I have 2 sons, and my eldest son had problems in utero, and he had problems with the birth experience. I ended up having to have a C-section with him, and he had difficulties in his early childhood development, which then showed up with difficulties that he had at school. I still think he is undiagnosed dyslexic, but he has coped extremely well since we found reflex integration as a modality, and we treated him when he was 11. And it was off the results of that I decided to retrain, because having spent 20 years teaching, the definition in education, a child can't do it, so they have to try harder, or we give them more of the same of what they can't do and expect that to make things better. And it doesn't work. So for my son, we had to find other answers. I knew something wasn't working right in his brain, but I didn't know what. And so my journey began, looking for answers, looking for solutions. And this is what brought me to RMT, because rhythmic movement training is the modality that was used to help change his life for the better. So I retrained, and as you can see from my first slide, I am a registered instructor in Rhythmic Movement Training International, and I'm also a registered and qualified observer, which means I can travel around the world observing people teaching the courses, particularly the level 3 of the courses, and saying, yes, you can do this well, and you have permission from RMTI International to continue to teach it. So we have several instructors in the United Kingdom who are qualified to do various courses, and we will talk about them. So I grew up in Zimbabwe, and Rabia has already mentioned the impact of trauma, and we cannot underestimate the effects of trauma from generational trauma as well. So my parents were children of the Second World War. So what did that do to their nervous systems in learning how to feel safe? Their parents were children of the First World War. What did that do to their nervous systems in learning how to feel safe in the world? And then I was a child of Civil War. So what did that do to me? And how has that then passed down through the generations to my sons? And I really believe that early trauma in utero was a trigger point for my son's development of his nervous system. And that has really kind of been a deepening learning journey for me as a mother and as a practitioner, and being able to recognize it in the children that I have the privilege to work with. So I'm very delighted to say that my son went from not being able to really cope in any kind of environment in school. He could read, but he couldn't write, and his spelling was always very poor. He had coordination difficulties. He didn't learn to walk until he was 18 months old. He didn't learn to ride a bicycle until he was 9 or 10. And he had enormous difficulties at school, huge anxiety, sensory processing difficulties, though I didn't know it for that at the time. And now he's he's got his degree at university, and he's working happily for a company in London. So he's come a long way. We never thought he would get this far. So we're delighted with his changes, and that's what motivated me to retrain and start working with children, trying to get to the root cause of why it was that their brains were struggling to do the things that we would typically expect them to be able to do. So that's how I got here. And I absolutely love what I do. I qualified in RMT as a consultant in 2012, and then I qualified as an instructor in 2015. And I've been on a journey. So I'm now one of 3 instructors in the United Kingdom who can teach all of the existing courses in RMT at the moment. I'm saying that because there are more being written as we speak. So it's very exciting to be able to bring this to you and to share it with you. So I do travel internationally. I'm just finishing off this year after 9 years of taking RMT to the Netherlands and training people up in the Netherlands, where I'll now be handing over the ongoing teaching of RMTI in the Netherlands to 3 very capable instructors, and they will not need me anymore, which is great. I also train in Ireland and Northern Ireland, and I'm in talks to take RMT to several new countries this year. So for those of you who don't know what primitive reflexes are, they are an inbuilt program that is hardwired into everybody's brainstem. Different reflexes are connected to different areas of the brain, but mainly in the brainstem. The brainstem is during the birth process, because there's a symbiotic interaction that goes on between the mother's contractions and the baby being able to respond to those contractions. And the stresses of kids, any age group. The youngest I've worked with is three weeks old, and the oldest I've worked with is 87. So it really does work with anyone. It's extraordinary, the capacity for change. So we're going to do you want me to put the PowerPoint up? Start grease. Okay. So, what we have to remember is that if we are struggling with function, there's always a reason that we're struggling with function. And if you want to go and find the root cause, more often than not, we can trace it back to the early development in utero and how well this inbuilt pattern has actually established in the system. And yes, it can be used for children who have got cerebral palsy and children with delayed milestones. Right. So the thing is, what we have to understand is that the brain and the central nervous system functions by how well we are processing sensory information in. And then that goes and travels through various centers within the brain, and then the brain regulates a motor response out. So here I've got a slide that just shows you the connection between certain sensory systems, and this isn't all of them, that are connected to particular reflexes. So for example, our vestibular system is regulated in the inner ear, but there are nuclei in the brain stem that have to send the information to the brain in the first place. And learning to regulate vestibular sensory information in a balanced way is what our nervous systems have to learn to do. It's not something we're born knowing how to do. The fear paralysis reflex, the Moro reflex, the ATNR or asymmetric tonic neck reflex, the symmetrical tonic neck reflex, and the tonic labyrinthine reflexes are all head and neck control reflexes. And they play a fundamental role in the development of that vestibular system being able to establish good communication to the brain. And the cerebellum is another part of the brain that is involved with all of this piece. Touch is another sensory system. There are two aspects to touch. When we are being touched, can we register that as being safe? And if I am touching something, how do I learn to register whether it is safe or dangerous? And this is intertwined with food issues, clothing issues, fussiness about fabrics, sensitivity, not wanting to be cuddled, etc., etc., and reflexes that can commonly be tied in with this imbalance in processing of sensory touch, of sense of touch, fear paralysis reflex, Moro reflex, spinal galant reflex, and spinal parese, but also rooting and sucking and hand-mouth Babkin. So auditory, how well do we hear? We get a lot of parents who say, my child doesn't listen to me. I have to repeat myself. It's not that they're not listening. It's that their brain is not processing what is being heard. And sometimes we can have oversensitivity to auditory input, and sometimes we can have undersensitivity to auditory input. And so you've got to explore what is going on, what is the brain actually taking in. Typical reflexes associated with the development of auditory systems, fear paralysis reflex, Moro reflex, tonic labyrinthine reflex, spinal galant and spinal parese, and the ATNR. And there is another reflex I would add in there, which is the bower crawling. But it's just trying to give you a little taste that no one thing develops one aspect in our nerve. Reflexes work together to help the brain to operate optimally, but we also need the brain to function. You can't actually separate sensory information from reflex integration, and you can't separate reflex integration from overall brain function. With primitive reflexes should develop into lifelong postural control. And when we have reached that point, this is when we can achieve more optimal function in our brains. And our brains are remarkable. They do adapt. They do find another way. Come what may, no matter what's happened, our brain has got us upright and walking. But at what cost? And can we reduce anxiety? 100% yes. We can reduce anxiety with RMT movements, because you have to trace back, where is the anxiety coming from? Why does it exist in the first place? More often than not, it is there because our nervous system is struggling to function optimally. It is struggling to regulate choice of how we react to sensory information. Too much or too little is going to cause stresses in the system. So with RMT, what we are looking for is finding ways to bring regular sensory information into the body, into the nervous system, so the brain starts to get an idea of what regular and balanced sensory information feels like. So reflex integration, RMT itself, is a reflex integration modality. There are many of them in the world. So Rabia has already mentioned she is qualified in the Melelio method, which is another method that works with reflex integration. RMT originated in Sweden in the 80s and was developed by a lady called Kirsten Linder, who actually spent a lot of time photographing babies moving on the floor. And she noticed that there were specific patterns of movements that the babies naturally sought to do if they had the freedom to move. And from there, she then made the leap of, well, what happens? Why are the babies doing these movements? And what happens if we copy them? And we don't really know how she made that leap, but she did. And she was then started working with children with really significant learning difficulties and motor problems. And they started to get better. And Dr. Harold Blomberg, who is represented here in the slide, he was a Swedish psychiatrist who had had polio as a child. And he had tried many, many different things in his lifetime to improve his own gait and his own ability to move more freely. And nothing had really conclusively worked for him. And he heard about Kirsten Linder's work, and he went to her to see if he could learn the movements himself and to see if they would help him. And they did. So he then took the movements back to his patients, and he was working, introducing them into his overall practice, and they significantly improved. And he found out that the RMT movements could help with Parkinson's and anxiety-related disorders and schizophrenia and bipolar and all of these kinds of things. So he had a really tough time trying to make his observations seen and accepted in the psychiatric world. But he started writing manuals and trying to figure out what it was that these movements were actually working on in the brain, why they were working, etc. And so his whole the birth of rhythmic movement training started. and he wrote 3 courses, level 1, level 2, and level 3. But if they were only available in Swedish, and the only country that speaks Swedish is Sweden. In the early 2000s, he met Moira Dempsey, who is a kinesiologist and educational kinesiologist from Australia. And she's pictured here in the lower picture. And she's had been exploring primitive reflexes for several decades by that stage, and had a passionate interest in them. And she met up with Harold Bomberg along with Svetlana Moskotova, who was another pioneer of reflex integration modalities with the MNRI approach. And they worked together to work with children who were in the Romanian orphanages. And of course, the neglect and the impact on brain development neglect has on the brain. And they collaborated, Moira and Harold collaborated together, and Moira worked with him, said, look, I'll help you to get the manuals translated into English so we can start taking it to a wider world. So in 2006, rhythmic movement training was introduced into the United Kingdom, and it's been growing ever since. It is available in multiple countries around the world and spreading all the time, because a lot of practitioners find it dovetails beautifully with the way they work, and it helps them to understand the nuances of movement in ways that they didn't understand before. And we find it's extraordinary, the results that you can get. So it really is going back to watching what babies naturally do. These movements are innate in all of us. With RMT, we work on the floor because this is where a baby learns to get control of their bodies in the first place. And it's amazing how you can actually pick up the difficulties with movement so much more easily when you observe them on the floor than you do upright and walking, because the best compensations in our systems are actually what's got us upright and walking. And the movements themselves provide gentle, regular, vestibular, proprioceptive, and tactile sensory information in. And we teach people how to notice how much stimulation is enough for the individual, because every person's nervous system is different. You cannot say to somebody, right, you're going to go home and you're going to do this movement for 2 minutes, because that might be too much for the individual. And then all you're going to do is overwhelm them and tip the nervous system more into self-defense, which is not what we want. We want to help mature the nervous system and give them the resources to choose, to be able to choose what they pay attention to choose what sensory information they are going to let in, to choose how to react, choose how to behave. And that only comes from a balance in the system. We do not want to tip the nervous system into more self-defense and negative self-defense. And this is where a lot of people are stuck when they start coming for therapy. So that's what sets us apart, is we work with the individual rather than the process. And we teach you what to look for. We teach you what to feel for, to know that the nervous system and that individual is safe with what is being experienced. We have got 6 core courses which we currently teach, and you can start your journey with either the RMT1, which is the focus, organization, and comprehension, which is this course here. It's a 2-day course. Or you can start with the making connections. I'll come back and go through what each course is about. We have a course called Making Connections. Don't know if you can see that. All right. And we also have a course which is called RMTI for school readiness. And many people think that that's only for 4 and 5-year-olds, but it really isn't. So these are the starting points you can choose from. I will tell you a bit more about each of the courses now. So the level 1, which is the focus and concentration one, is about the reflexes we know are typically connected to our ability to sit still and to focus and to concentrate. And, you know, a lot of that is down to, have I got a balance in sensory processing? Have I got good core strength? Have I got good head control? Have I got good visual stability and tracking? Have I got auditory balance? These things are absolutely critical, and they are discovered and explored through movement and learning to make sense of my body in space before we ask a child to focus and concentrate in an academic situation. So you'll cover things like the tonic labyrinthine reflex, the asymmetric tonic neck reflex, the symmetrical tonic neck reflex, spinal galant, landau, and amphibian are reflexes we cover, and of course the feet reflexes in level 1. Level 2 is a 1-day course. Okay, and this one is the course about how do we learn to regulate our emotions and to regulate our memory and to regulate our behavior. And actually that starts with knowing how to feel safe. And if I don't know how to feel safe in my body, I don't know how to feel safe in the world. And this is absolutely fundamental. Safety is actually the beginning, and learning to feel safe is one of the primary roles of primitive reflexes. How to feel safe and how to survive. These are all fundamental foundations to our function. Level 3 is a 2-day course. Level 3 is all about what reflexes are connected to our ability to learn to read and to write, and also the development of our auditory and our visual processing skills. And we look at the anatomy of the brain involved in that process. Making Connections is a 2-day course, and it is all about the brain and the development of the brain and how we can actually test the function of each area. So brainstem, midbrain, hindbrain, the mesencephalon. We can test the mesencephalon. We can test the limbic system. We can test the cerebellum, and we can test overall function in the cortex of the brain through very simple movements and observations. And we teach you how to do that on the Making Connections course, but we also then are able to demonstrate how the RMT movements can positively impact the function in these different areas of the brain. Then we have got the Face the Fear, which is a special interest course. You can only learn the movements in the courses themselves. You cannot learn them in life over Zoom. Yeah. Face the Fear is all about the reflexes connected to learning to feel safe and reflexes connected to learning to communicate through speech, and various techniques that we use to bring balance, to reduce trauma in the bodies, which is critical. If we don't know how to release trauma from our bodies, then that can stop us from making progress in life. And it's a very, very powerful course, very profound course. Then we've got 2-day course, school RMT for school readiness. And this is a course that prepares you for how can you see when reflexes are retained in a child's body in a classroom situation. And what does it mean for them? What does it mean what is the impact on their learning? And if we actually bring in movements and activities in a school situation, can we then make it possible for the child to actually make progress? And the school readiness course is relevant no matter what age the child is, because if those foundations are not in place, we're still not ready to learn. And the school readiness gives you great observation tools that go beyond what you would learn in the level 1, for example, and lots and lots and lots of fun ideas that you can incorporate through play to help a child to develop better control over their bodies, because the more control they have over their bodies, the more control they have in their brains. And that's really the dance that goes on between reflex integration, movement, and brain function. And you learn all of these movements in the courses. They used to have some of the theory online, which was brought in during lockdown, but I'm not 100% sure whether they have kept them going. We have different types of movements. We have passive movements, which are movements we do with the child. And it's the parent who is the giver of the movement and the regulation of the movement. And they mimic that early growth experience in the womb, because when the baby's growing in the womb and the mother is moving around, there is a passive experience of movement. There's also the passive experience of movement, listening to the mother's heartbeat and her digestive system and all of these, and her breathing. So there's all that passive experience of movement in utero. And then once the baby is born, we hug them and we rock them and we carry them. The baby is not having to consciously think about movement yet. And so this is where the passive movements come in. And we know from tests and trials that they literally stimulate every area of the brain naturally. Then we have active movements, which is all about learning to control very specific parts of the body. So head control, okay, arm control, leg control, trunk control are all developed by learning to do these active movements absolutely precisely and accurately, with no other parts of the body trying to help. Then we have kneeling and sitting movements, which continue to develop the postural control to a higher level. We learn to control our bodies horizontally. Then we learn to control our bodies in the midline, in the middle, so like on hands and knees, before we learn how to control our bodies being upright and walking. And the RMT movements take us through each of those phases quite naturally. And they have to be done with rhythm, with flow, with symmetry, with exactness. And the more efficiently they are done, we can actually map that there are fundamental positive changes in the brain. Because the more organized the body becomes, the more organized the brain. If we have back problems, etc., then we know that the brain does not know yet how to regulate the muscles that regulate our posture upright. And the exercises do address different aspects of spinal control as well. So it is really important, obviously there's a question here, can it be related to bad posture, etc., Absolutely, and to sedentary lifestyle. We don't move enough. And if we don't move enough, our brain doesn't connect up enough. The way you can tell that we have still got retained reflexes regulating us, even as adults, is if we have postural instability, poor balance, poor ability to keep ourselves upright without it getting stressful and tiring through the shoulders and through the lower back. We'll have low muscle tone. And on the opposite end of the spectrum, you'll get very high muscle tone. But there isn't that balance in muscle tone, because the high muscle tone, the brain has locked you down to get you upright and walking. Low muscle tone is where you get them touch, the muscles are really soft, and you kind of think, wow, does the brain really know that these muscles actually exist? What sensory signals are communicating to the brain and the brain to the muscles and vice versa? So we're looking at all of these things all the time. If we have difficulty regulating our emotions, it's going to tie in with poor brain development from the brain stem into the limbic system. And then you can struggle with things like anxiety and depression, and often goes hand in hand with a weak core and poor breathing. Fidgety, not able to sit still, is always tied in with I don't know who I am and where I am in space, and I don't know how to feel safe in space. But there can also be tactile sensory processing, vestibular sensory processing difficulties, and proprioception sensory processing difficulties wrapped up in that. So yes, we can change that with the right intervention. If you get there, always got to support yourself because your brain doesn't know how to keep yourself upright naturally. This is tied in with reflexes not being integrated yet. W sitting. Does anyone here need to wrap their feet around the chair when they're sitting on a chair? Or kneel on a chair, or wrap their legs around the chair legs themselves, or they have to stand. All of these will be indicators that there's something fundamentally not working optimally in the body yet. Difficulties with coordination would then make you reluctant to do any exercise, reluctant to move, reluctant to go and participate in things, because it's jolly hard work for the brain to regulate. So it's these things you start then developing defensive mechanisms, avoidance tactics, because you don't want to do it because it's too hard to do. And it's too hard to do at a deeply subconscious level. Poor retention of learning. Yes, if your nervous system is stuck in survival mode, stuck in fight or flight, because the reflexes haven't matured properly in the nervous system, we stay in a sympathetic state. And if we're in a sympathetic state, we don't get that access to the choice, the parasympathetic, where I can calm myself down. And if I'm in too high anxiety, then what happens is I cannot take my learning from short term into long term. It's just the way the brain works. Safety is absolutely foundational and critical to the whole process. Concentration issues, difficulties learning to read and write, because we always focus on my child learning to read and write. We focus on the academics, but really we need to be safe in our bodies first, have optimal postural control, like this child in the photograph here. You can't, if we've got this slumped spine, can you see the pelvis is tilted back? And then the spine naturally curves. That's going to slow down the flow between the cerebral and spinal fluid. And that contributes to poor focus and concentration, signals communicating to the brain. So this is, getting this in balance, being able to control my deep core, to sit on my sits bones, then naturally helps my spine to stack correctly. My head is in the midline. I have optimal visual stability with the board, being able to switch between the board and back to the page, etc. All of these things are possible if we can help a brain to establish better postural control. And I can demonstrate to you some of the changes that I have seen. And I've got loads of stories I could tell, but time is of the essence. So all of these will be indicators that reflexes are not integrated, even if you are an adult. I know I don't have all of my reflexes integrated yet. I am much, much better than I was, but I know fundamentally from thinking back to my early childhood development, etc., the things that I have struggled with all my life, I know certain reflexes never did their full developmental journey in my body, even at the beginning. So that then made life, and coping with life a lot more challenging for me, but I am much, much better than I used to be. Right, Rabia, if we go to the next slide, we know for a fact that RMT helps to improve coordination naturally. When we have better coordination, we are better able to focus and to concentrate. We have much, much more emotional stability. Our reading skills improve dramatically. Fastest I've seen reading skills change 4 days. I'll tell you that story in a minute. Handwriting and language skills dramatically shift. Fastest I've seen is 3 weeks, but I have got a little testimonial to share with you. And language skills, I've had children go from 1-word sentences to 15. Mathematics skills, if the brain is communicating optimally across the 2 hemispheres of the brain, mathematics skills improve, and our ability to learn and to memorize dramatically improve as well. So I have seen this happen. I've seen children make the equivalent of 4 years academic progress in 1 year. I've seen children make the equivalent of 4 years academic progress in 6 months. But every nervous system is different, and you cannot predict how quick or how slow someone's journey is going to be, because everyone's different. There isn't a recipe for each person. You have to meet the child where they're at and to build them up from where they are at. Thank you. Next slide. So,
I'm
who
just
is it
want to
for?
ask you a question.
Yes.
I'm just want to ask this RMT is suitable for the geriatric population with stroke rehab.
Yes.
They're going
Yes.
through the stroke rehabilitation. In the later stages of the rehabilitation, they have the problem in doing the functional activities. So
Yeah.
could we people can induce RMT in those generations?
Yes. 100%. Absolutely. We've got testimonials of it making dramatic changes for the geriatric population as well. And it's gentle enough for them to be able to take it in their bodies, which is what's so beautiful as well. Yeah. So anyone who works with a person, basically, if you're a body worker of any kind, RMT is almost guaranteed to dovetail beautifully with what you do. So I've worked with OTs, physical therapists, psychologists, counselors, psychiatrists, healthcare professionals of any kind. I've worked with many, many parents, many teachers, any carers, and people who work in kinesiology, so body related conditions. I've also worked with people who've taken themselves on this journey for their own self healing and their own recovery from trauma, because trauma stays in the body and it disrupts everything, reactivates all the primitive reflexes again, because the primitive reflexes are trying to help you to survive after the trauma. And for some people, if those reflexes never matured properly before, then you have a really hard time getting them to settle back down after recovering from trauma. So as I've said, I've trained all of these chiropractors, osteopaths, occupational therapists, physical therapists, dance instructors, doulas, so birth midwives, play therapists, teachers. These are all the kind of people who have come on the courses and have got benefit from doing the training, and they've embraced it, and they just say how much they love working with RMT, because our approach is quite different to most other modalities out there. Right, thank you, Rabia. Next slide. So I don't know how well you can see this, but the image on the left is this was a child. I don't know what her grades were when she started primary infant school, and I don't know what her grades were when she was in year 3. So in England, we start when children are 4. By the time they're 7, they transition from infant school to primary school, junior, yeah? And then by the end of year 6, we want them to be at a specific level academically. And this line here, that blue line across the middle there, shows you where we would want a child to be academically at the end of year 2. And you can see this child left year 6 at a level we would expect at the end of year 2. She worked with me for 1 year, and you can see in the gray bar right at the end the academic progress she made in that 1 year, which equates to 4 years academic progress in the United Kingdom. And that was when we brought RMT into her intervention program. They hadn't done it before, and she'd had one-to-one all the way through her school career, and nothing had made that kind of impact. You can see her results were quite exponential. And this was because we worked on organizing her body, teaching her how to feel safe in her body first, and then everything else took care of itself. In the picture on the right, I have examples of another client's handwriting. The handwriting sample right at the back is an example of the child's handwriting in the summer holidays before his parents found me. So this would have been August 2014. And he'd finished year 2, and his teacher had taken the parents aside and said to the parents, we think you need to get him assessed for dyslexia, because his handwriting was so poor and he was really struggling on so many different levels. The middle sample of handwriting was done 1 week after his first RMT session with me. And you can already see the handwriting starting to transform quite dramatically. And then the front sample is an example of his handwriting 2 weeks after his second session. You wouldn't believe it was the same child. And I have got plenty of examples of this type of change that I could share with you. So when it comes to handwriting, the brain needs to understand how to use the hands correctly and needs to know how to isolate into the fingers, into the wrist, into the forearm, and from the shoulder. There's also a very big visual component to this. So we teach you how to see this, how to work with this. We use not just the movements, we use a variety of other techniques, which we teach you on the courses, including techniques called isometrics, which really confirm for you whether a brain has mastered a movement pattern in the first place or not, and how you can then educate the brain to make better connections throughout the system. So this is just a couple of examples. Another story, we teach you how to look at the body and to notice what the body is doing and what postural control resources we have. So this photograph on the left-hand side was given to me by a parent. And you can see the boy on the left has a very curved, slumped, forward sticking posture. His pelvis is tilted back. He has very poor spinal control. You can see his shoulders are quite collapsed, and he's really got very, very poor postural control. The boy on the right was the child I worked with. And when he started with me, he was a school refuser. And he had massive sensory processing difficulties to the point that he couldn't even cope with wearing his school uniform. And he was a very angry, very frightened young man who would kick off at school and throw furniture around the room and really was being excluded on a regular basis. And he was a very lost young man. Within months, we had turned him around. And he then went on to be in school full-time and passing all of his exams, etc. Just totally turned his life around. And we just did it by working with the primitive reflexes and trying to find a way to balance his sensory processing difficulties. The story with the one on the right-hand side, this is a child who I worked with for only 6 months. he was diagnosed with dyslexia again. He was on track to fail everything by the end of primary school and was really struggling with getting into school again. But he was also a competitive swimmer and swam professionally. And he was the child who I worked with him. I had my first session with him on a Thursday. And Mom told me in that session that it would take him half an hour to do the equivalent of what was meant to be 10 minutes worth of reading homework. And when I looked at his eyes and his ability to work his eyes together as a team, he couldn't do any of it. He was really poor postural control all the way from the top of his head to the tips of his toes. So it must have been a huge effort to swim fast. He started with me in the January, and you can see on this graph, I've put in a line, a purple line, which shows you at which point he started to work with me. And within a week, his speed with which he could swim started to improve. And his personal best, you can see, took a dramatic shift. And he then went on to pass everything in primary school and never looked back for secondary school. So those are just a couple of very small stories. Rhythmic movement is a very gentle reflex integration program, but it is very powerful. And more often than not, we can tailor it so we can help a nervous system to grow and to grow safely. These courses are not available online. We have to teach you the nuances of the movement in person. And this is why Rabia is thinking about bringing me to Pakistan so I can train people in Pakistan. Any questions?
Ma'am, I want to ask a question. First
Yes.
of all, people will also warmly welcome to you in Pakistan whenever you will
Thank you.
arrive here. Okay.
Possibly May.
Okay, inshallah.
Yeah.
Nice to hear about it.
Yeah.
Okay. Ma'am, I'm just want to ask that we have been seen in other therapies, like I have been learned about CME, charismatic exercise therapy. There was an assessment criteria was also described. Is there in rhythmic movement therapy, you have your own assessment criteria? Or you
Yes,
have
we
been
do.
the patient?
Yes, we do. We do have our own assessment criteria, and we teach you how to see it and how to work with it as we go through the courses.
Okay, nice one. Thank you.
Any other questions?
Yes, there are a few questions that I noticed. So first of all, is RMT useful for preteen kids? How does it help preteen kids?
Oh, yes, works with any age.
And how does it help in apraxia and dyspraxia?
Well, because what you've got to do is you've got to go back to where does the problem start? What is it that the brain hasn't put into place yet? So we teach you to look for it through the lack of control through the movement, trace it back to what reflexes teach the brain that piece, and then how can we help the brain to reorganize those connections naturally. And this is where we would particularly use the isometrics to reorganize and to reconnect. But the movements themselves are getting that regular sensory information in. And slowly what you find is that the brain kind of figures out for itself what it's missed out.
Mm-hmm.
And I've seen this happen time and time again, where I might be thinking I'm targeting on one aspect, but the next time I see them, which is I see my clients every 4 weeks, because that's what it works with the time frame of plasticity change. 3 weeks of regular input.
I have a question.
Yeah, go ahead.
Can RMT improve cognitive functions, particularly in areas like attention and focus?
Yes. That's the first course.
Okay.
And psychological issues, yes. We've seen it make profound changes. Reflex integration modalities, it's any modality that works with the principle of integrating primitive reflexes that haven't completed their developmental journey in the body. All primitive reflexes should wake up. They should go on a developmental journey. Most of them should peak in the birth process, and then they integrate into the nervous system as the baby learns to get themselves upright and walking against the pull of gravity. And then they transform into lifelong postural control. We know that the difference between lifelong postural control and reflexes and primitive reflexes means that when we've got lifelong postural control, we are in control. We have cognitive and unconscious control over the way we move. When primitive reflexes are still controlling the show, then what happens is we have involuntary reactions to certain movement patterns. And this is the nature of what we observe, is how much of an involuntary reaction do we have to particular sensory or motor stimuli. And then that tells us where on the developmental journey a primitive reflex still is in the nervous system. And we need them to integrate so that we have unconscious control over the way we function.
Okay.
So we've got MNRI, we've got RMTI, we've got the Melalio method, there's INPP, there's the Harkler method, there's all sorts of methods out there if you go looking.
Okay, thank you so much. Okay, there is one more question. How RMT can be used in physiotherapy?
Yes, absolutely, it can be. I find that my physical therapists, what they find really useful about doing this is that they understand the root cause of why an injury might keep happening to somebody, and why they have to keep working with the same thing all the time, because actually the primitive reflex that teaches the brain that piece hasn't resolved in the system. And so when you go back and you work on the primitive reflex, then you're much more likely to get better reorganization in the body. So, for example, a conversation I had with one of my physical therapists who I trained, she says, I've got this client who keeps coming back to me for neck injury on the left-hand side all the time, always have to work on the same side, da, da, da. And then she pauses, she says, it's the ATNR, isn't it? Okay, so it's about looking at where do the injuries recur? What is it that teaches the brain to understand that body part properly in the first place? Let's make sure that that's in place, and then hopefully you can actually resolve the ongoing injury and stop it from happening again.
Like in my
RMT,
like
has
in my
that.
practice, I see that for the kids and adults also, if they are having any severe gut issues or thyroid issues, and this, so TLR is playing a major role. They have unintegrated TLR forward reflex. That's how it is creating problems. So until unless I don't release that, I don't work on that reflex to get integrate, they cannot have a good release with the gut functioning and with their visceral functioning. So it's really like great with the posture and all thing. Reflexes I found are the major like thing for all these postural issues and all that.
Yeah, if you think about them as being the foundation blocks
exactly
of the development of our central nervous system, the foundation blocks of our physical control. And when we have those integrated, then our brain really does have optimal understanding of how our bodies should work. And then when that's happening, it's much more effortless for the brain to regulate everything else.
Exactly.
Hi.
There is one more
Hi.
question.
One more question?
Yeah, I have a question.
Yeah.
I'm Dr. Yes, I have a question.
Yes, please.
Carry on.
I am Dr. Shazia. Is this RMT is the beneficial in speech therapy? And if yes, how?
Yes, 100%. The Face the Fear course is the one that particularly develops the whole concept of how much speech is connected to a sense of safety, but also which reflexes teach us to get the muscle control in the lips and in the tongue and in their hands, and bonding and connection and attachment, which often go hand in hand with speech and language difficulties. And then, of course, we expand on the relationship in the temporal lobes, which are connected to the Wernicke's, the Broca's, and the angular gyrus of the brain, which is also developed in speech, and of course the cerebellum. So speech is complex. So if we can get all of those areas of the brain communicating with each other much better, then we can get shifts with the speech and the development of language.
Oh, great. Thank you. Thank you
You're
so
welcome.
much.
Mhm.
I
Okay.
have a question.
Yeah.
What role does RMT play in addressing chronic pain and inflammation, and how does it impact in physiotherapy outcomes?
So chronic inflammation will primarily be a result of something to do in the gut and potentially right through the central nervous system, which does need to be addressed through nutrition and detoxing and things. And I think, Rabia, you'd be much better qualified on that. It's not an area of my expertise. And then once that is reduced and that is balanced, then RMT can come in and we can address the rest of the system. Because the thing is, if you've got chronic inflammation going on in the gut, that's going to be keeping us reacting at a cellular level, which then can stop everything else from locking into place. And in my understanding, the fear paralysis reflex is a cellular response to stress. So by working with balancing nutrition and reducing inflammation system, working with the fear paralysis reflex at the same time, you can help the nervous system to learn what is safe and what isn't safe in a more balanced way. And then we can start putting in the rest of the building blocks.
Okay, one more thing I will add about the inflammation or infections regarding RMTI. So what happens basically when we work with this rhythmic movement, so basically the fascia of the body get loosened, and cerebrospinal fluid is more, the restrictions are getting released. So there is a more space for cerebrospinal fluid to more be regulated towards the brain and the body. So what happens when the body get a release with RMTI? And what happens, there is more space of vagus nerve to work with to connect the brain and body. Okay, so whatever are the restricted areas that are hindering the functioning of the vagus nerve, so when the brain and body connects better with vagus release, so inflammation, I'm seeing that automatically getting released, that there is no need to work for this separately. It is whole part that I can see with my patients, that with this release they're automatically functioning gets started. So that's basically with the what relationship.
Working with the top 3 vertebrae, isn't it, Rabia? For vagus.
Yes.
Working with the top 3 vertebrae.
Yes, exactly. Exactly. Yeah, exactly.
So this is where something like what Rabia does, the cranial sacral, this is very important, that we make sure the vertebra and the neck are completely aligned. Yes. And I always recommend to my clients that they work alongside other body workers to make sure the structure of the body is absolutely in place. The primitive reflex's main role is to help to develop the muscle tone and our access to movement and independence of movement. And when we master that, emotional regulation, etc., also locks in an ability to focus and concentrate.
How does RMT impact range of motion, flexibility, and mobility?
It improves it. It teaches the brain how to actually do things more optimally. Because of the way we insist on the movements being done correctly and with rhythm and with flow. Okay, any other questions?
And when basically this rhythm gets started, so the body is more connected to the sensory cortex. So the clear messages are going to the sensory cortex, and the more outcome is more better outcome from the motor cortex is coming. So then automatically so many pains, so many issues, they get posture automatically get aligned. So this is basically
Yeah.
like the
Sensory
sign.
in, motor out.
Exactly.
They have to
Sensory,
work in balance.
exactly.
Yeah.
Good sensory goes in and the motor, good motor comes out.
Mm. And it
Assalamualaikum.
is
One this question. Is we do RMT with machines or manually? Which method is best?
there are no machines involved with RMT. It's just your hands and the floor. Because
Okay,
that's
thank
what
you so much.
babies need when they are little. They
Thank you
don't
so
need
much.
anything else. Okay. I don't know anything about Falun Gong to answer this question under RMT. I don't know. So just natural movement. Natural movement. I can't share copies of what the movements look like because of the copyright, so you'd have to wait and learn it on a course.
Ma'am, is RMT and vestibular training are same?
They're not the same, but we do work on the vestibular system through RMT, yes. When the course will start, we're looking at trying to get a date in for May. I can't really do anything earlier than that. Any other questions? We are still working out the Rabia, you could speak about the cities. So I've already mentioned the courses most of them are 2 days. All right. And then there's one course that is a 1-day course. In my experience, it doesn't work to do them all back to back because it's too much information, not only on a theory basis, but also too much information on a movement basis, which is very overwhelming for the nervous system. So I always prefer to have a bit of a gap between courses to give your body's time and your brain's time to process what you have been doing. So it'll be a case of I might come out and do 1 or 2 courses a couple of days apart. And we're thinking about doing one course in one city and then traveling and doing a different course in another city. And then what I would do is come back every 6 months or so and take you through the next steps and the next steps and the next steps. So gradually, over maybe an 18-month period, you could get all of the RMT into your toolkit. And then you've got to do 3 case studies, which I would mentor you through. And then when you've proven to me through those case studies that you have demonstrated a good starting of understanding of the work, then I can sign you off and send your details to the head office and you apply for your certification as a recognized consultant in the world. And all of the certificates will be e-certificates online. They're not necessarily an e-certificate today. That was not part of the discussion, no. Okay. Rabia, do you want to say which cities we're thinking about running the courses in?
Yes, we are having the option of 2 cities, first in Lahore and second in Karachi. So let's see that how much participant, how much are
Interest there is.
interested and getting registered. So then we will decide, okay, which city will be the first one or and where we can start first. And obviously that's your availability in the May. So we will be uploading this whole seminar on our page. So whoever missed, they can get connect and if they wanted to register, so they can tell.
Yeah.
Okay, there is one more question. My daughter is a slow learner and I want her to be assessed.
That's doable online. Okay. Better done in person, but it is doable online because if there's slow learners, there's a reason that there is a slow learner. And telling them to try harder isn't going to change anything. We have to look at the root cause. And this is where assessing the primitive reflexes and assessing the different areas of the brain is really useful, because you can see what resources she does have to draw from and which resources she doesn't have yet. And then we can go on a journey to try and put in better building blocks for her so that her learning can improve. In the Epley maneuver, you are dealing with the buildup of crystals in the inner ear, which is affecting the vestibular system. With reflex integration, we're looking more at what are the building blocks that helps our brain to establish balance in the way it registers this sensory information through the vestibular system. So they are different things. Okay.
Is there any other question?
That seems to be it for today.
Yes.
Yeah, and honestly, if anybody wants to ask any more questions, I do provide online support for all of my trainees. So it's not a case of I would come in, teach you the course, and then push off. I am always available between courses for questions and for support. I really feel very passionately about training people up to the best of my ability. I want to make sure anyone I train enters into this field with confidence. And if you're not confident yet, then I have to do more to help build your confidence in what you're looking for.
And that's why we are here for you. And it's a really an honor that you accepted my request and giving us the opportunity to learn it directly from you. So this is really a great opportunity for me as well, and obviously with the other audience as well, I must say that. Okay, so Hani, other question, there is some, I guess. Looking forward to see you in the Pakistan and learn from you. Okay, right. Yeah,
Yeah.
inshallah. Yes, in May, inshallah, we will be doing this training, and she will be coming here. Okay, so Gaynor, thank you so much for
You're
this
most welcome.
session, for the wonderful session. And apart from all those difficulties with the internet problem, then he was having the problem, then my just this internet got just shut down, and but still I really learned a lot and
You're
hopefully
welcome.
others also. So it is really a great opportunity. Thank you so much. Thank you so much for giving us this opportunity.
You're most welcome. If anybody just wants copies of the slides, that's absolutely fine. Yeah, no problem at all. All right. I look forward to meeting some of you, hopefully in a couple of months' time.
Yeah, inshallah.
You're most welcome. Take care, everybody. God bless.
Okay, thank you.
Right.
Thank you so much. Okay, thank you so much, everyone, for joining us today.
You're welcome. Take care, everybody. Thank you for joining us.
Yeah, thank you. Bye.
Bye.